Hey guys, this is Katie Atwell. This is our descriptive epidemiology assignment. This is in our epidemiology class. Just starting out, I'm a nurse practitioner, so I see and treat a lot of various illnesses. What I'm getting at is I chose norovirus as my disease. Of course, it's an ongoing epidemic frequently. It's a very frequent virus. I treat this quite often. It's commonly known to cause loose diarrhea, nausea, body aches, low-grade fevers, vomiting, basically just overall feeling ill. It's kind of flu-like without the respiratory cough and congestion part, but it's very, very common for all ages. It will have a new variant maybe every 2 to 4 years, and that's when we see those numbers spike. It is spread via hand-mouth, so basically fecal matter gets into your mouth, whether that's through contaminated food sources or contaminated surfaces, like somebody has norovirus, they touch it, you touch it, and then you put your hands in your mouth, or whether the food was contaminated where it was grown, it wasn't washed properly, wasn't handled properly. A lot of healthcare workers will get it. It's pretty common, with, you can get it from like babies, so like changing diapers, things like that. So direct contact with the virus is how you get it. It takes very little of the virus to cause you to be sick. But it's direct contact, whether that's with a person or contaminated surfaces, contaminated food, etc. So it's spread via hand-mouth, fecal, oral. Same concept. So just a little prevalence. This was discovered in 1972. Now, that's not to say that it wasn't around prior to that. It was, but this is when technology kind of started to come around to be able to detect these viruses and really investigate what's going on with them. So norovirus is associated with nearly 20% of all acute diarrheal cases globally. So basically, it's one of the main causes of acute gastroenteritis. It's estimated that 685 million episodes and 212,000 deaths annually per the CDC. And that's actually a global number, so that's worldwide, okay? However, in the United States, it causes about 19 to 21 million illnesses, including 900 deaths estimated per year, 103,000 hospitalizations, 460,000 emergency department visits, and 2.6 million outpatient visits. It spreads so easily and it's so common it happens a lot. We see it a lot. The ones that end up, hospitalized or deaths is typically through dehydration. It's been identified as a relevant cause of acute endemic diarrhea in children under 5 years of age, as well as the primary agent for acute gastroenteritis outbreaks affecting individuals of all ages. So it's one of the very common agents that cause gastritis: nausea, vomiting, diarrhea, abdominal cramps, fever. So epidemiology elements of a person. We've already stated most common cause of gastroenteritis in children and adults, although all age groups are at risk for contracting the virus. Those of extreme ages, so very, very young or very, very old, and those that are immunocompromised are at the highest risks of poor outcomes. Elderly patients are at increased risk of fatal outcomes. Those who work in food are also at a higher risk because they're coming in contact with food that's possibly contaminated. Hand hygiene, proper food handling, this is very important in preventing the disease. It's highly contagious. If you think about like a large family, especially 30, 40 years ago when there was, 10 kids in a family or whatnot, and they're all sharing one bathroom. One person's sick or one kid has a friend come over who's sick with norovirus, the whole household's going to get it. It spreads that easily. Those who work in healthcare or in daycares, those people are going to be at a greater risk just from dealing with fecal matter more often than others. epidemiology elements of place. Kind of touched base on this already a little bit in the previous slide, but all age groups, it's estimated that an annual incidence of norovirus to be 21,400 per 100,000 children under the age of 5. These are typically those that are, in daycare. I mean, especially those that are not potty trained, that we're changing diapers for. Not to mention, young kids that they don't think, hey, I have poop on my hands. They're putting their hands everywhere. They'll put their hands in their diaper, in their mouth, etc. It spreads very easily. They don't think about what they're putting in their mouth. So that's part of the reason behind that. Norovirus illnesses, outbreaks are usually more common in cooler months, but they can occur any time of the year. There's no specific, it won't occur at certain time frames. It's just more common in the cooler months, and that's mainly just because people are more indoors and in close area together. So in our area, most outbreaks are going to occur November to April, because that's our cooler months. We're closer, more above the equator, so that's going to be our cooler months. Those that are below the equator, theirs is going to occur more likely from May to September. Areas near the equator that pretty much have very similar weather most of the year, it's going to be more seasonal, or less seasonal, excuse me. I just wanted to point out too that if you think about it, norovirus has a higher prevalence in areas of higher concentration, so dense concentration of people. So if you think about like New York City, they all live in close quarters. There's 100 times more people in that area, not to mention the more people, but they live so close together. So it's going to be a higher rate, and it's going to spread like wildfire in these areas. I'd like to point out that the CDC does try to track things like this to try to keep an idea of, endemics, pandemics, and whatnot that happen. We track these things, right? That's epidemiology. So I want to touch base on that a little bit. All right, guys, I wanted to show y'all a link. When I was doing my research on norovirus, I found one of the reporting systems that the CDC came out with that it reports all kinds of diseases, viruses, and bacteria and whatnot, just to give people an idea of the numbers and to kind of track it, to see when we have epidemics, pandemics, whatnot on our hands. So I have the link here. This is the National Outbreak Reporting System, and I'm just going to take you there, kind of give you an idea, because it's pretty neat. So this is the website. You can pretty much narrow it down to anything you want. It has all the states and whatnot. You can narrow it down to diseases and time frames and all kinds of mess. It's crazy. I thought it was a really neat thing. So with that being said, I'm going to come over here to etiology. I'm going to narrow it down to norovirus, because that's what we're talking about here. So when I narrow it down to norovirus, let's see, so from pretty much, the last overall 10 years or so. So as far as outbreaks, now these just aren't cases, these are outbreaks, right? So these are when there's a great amount of norovirus going around. A couple things I wanted to point out here. So I'm from Mississippi, so of course I went straight here to Mississippi. 111 outbreaks over that time frame. Alabama 178, Georgia 102. So as you can see, these areas are very similar. Because of that's that area, right? We're all kind of rural type areas mostly, so less. But I'd like to point out, when you come over here to California, 436 outbreaks. You see how that's a lot more? I mean, there's more people over there, right? I mean, I don't know what Oregon's doing up there, but it's probably pretty cold and people living in tight quarters. But come up here to all these places that have bigger cities, and they live in closer areas together and whatnot, and you can kind of see, like, look at New York, 1,700 outbreaks. And I mean, if you think about it though, these are colder areas of our nation, so people spend more time indoors, but also, they live closer together. Think about New York City compared to where we live, so it's completely different. I also wanted to kind of point out here on this website, you can see these trends over the years, when it peaks and whatnot, when it comes down. What happened between 2019 and 2020? Coronavirus, COVID happened. We were staying away from each other. So you can tell that staying away from each other definitely takes an effect on norovirus, just like any other virus. They'll staying away from people and it prevents spread. That's why we did it in COVID, right? So then we have the epidemiology elements of the physical environment. Person-person transmission, most common form of transmission. You go up to somebody, you shake their hand, you put your hand to your mouth to bite off your fingernail, and there you go. Numerous point source outbreaks are attributed to improper handling of food. Infected food handlers or through the contaminated food or water itself. It can also be contaminated where it's grown, such as most common or very common is shellfish and produce. Currently, the CDC has a notification about Baja California's oysters. Don't eat oysters that are coming from Baja California. That's already on the CDC website. So things like we just talked about, like the tracking and whatnot, things like that helps us determine where it's coming from and what we can do to help prevent. It's also known to cause outbreaks in hospitals and healthcare facilities, other healthcare facilities, as well as daycares, because it only takes one diaper change of somebody that has it for it to spread like wildfire. You bring it in and that person doesn't, properly wash their hands, or just a small amount of fecal matter is still on them, hand to mouth. And then you go to the next patient, hand to mouth. It just spreads. So closed, crowded environments. We talked about New York City. I mean, these people all live really close together, so it spreads very easily. So just, to sum it up, examples of places where it spreads pretty quickly and more often: hospitals, nursing homes, child care centers, resorts, restaurants, catered events, schools, cruise ships. Cruise ships is a funny one. Norovirus is I don't know if you've ever heard of people calling a cruise ship virus, or the stomach virus, the cruise virus, or the Disney virus. Like these cruise ships, vacation areas, they'll have a nickname for it, but it's norovirus. That's what causes it. That's the stomach bug that people get off cruise ships, is from norovirus, either from the food on the ship or just the close encounter that everybody's in on this boat. They're all near each other. Most common in winter months. We talked about that. People spend a lot of time indoors in the winter because it's cold. Epidemiology elements of biological environment. High-risk food for norovirus: contaminated foods that are served raw, like fruits and vegetables, oysters, fish. Norovirus can stay on surfaces and objects for days or weeks at a time. I mean, in very little amount it takes to get somebody sick. It's possible that animals may be reservoirs of norovirus. This is still research that's going on. New strains lead to global increase in norovirus outbreaks. This occurs about every 2 to 4 years. Epidemiology elements of the social environment. We already talked about food handlers and whatnot. There was a systematic review of norovirus attributed outbreaks between January 2003 and July 2017, identified 27 publications that met the definition of confirmed outbreaks caused by food contaminated sources. There was 47 that met the criteria for outbreaks caused by food handlers. Outbreaks attributed to food handling involved a diverse range of foodstuffs, and occurred in multiple settings, including restaurants, events of catering such as weddings, and military units. Another thing to think about is social environment, cultural standards. If you don't wash your foods, or if you're not the most hygienic type of culture, then you have a higher rate or higher occurrence of norovirus. Contaminated water is a big deal in developing areas. That's also another way that it can spread very easily. Elements of time. We already mentioned that it occurs more in the colder months. It can spread from the first time you have symptoms until several days after you recover. Signs and symptoms usually begin 12 to 48 hours after your first exposure and last 1 to 3 days. However, you can continue to shed it in your stool for several weeks after recovery, so that's another reason why it spreads so easily. It can also stay on surfaces and objects for days or even weeks. These are just some tidbits, to help prevent the spread. What you can do, like washing your hands thoroughly, soap and water. is the best way. It's still up in the air whether sanitizer alcohol is quite as effective as soap and water. Rinse your fruits and vegetables well. Keep in mind changing diapers and whatnot. Wash your hands. If you become ill, stay away from people. And here's my references. All right. Thank you.